Peace, my beautiful family. Welcome to the Omo Show. I'm Omo, the Afrocentric creatress, here to raise the vibrations of the entire Black nation. And as I mentioned in my last video, I wanted to answer a few questions that people ask me all the time about my pregnancy, about postpartum, how am I doing things as far as motherhood is concerned. Just a disclaimer before I even get into the information. I'm about to be talking about things that not everybody is going to agree with. With that said, if you don't agree, keep your comments, if they're negative, to your freaking self. If you feel like the urge to say anything negative, just go ahead and press that X whenever you feel that urge, okay? Because I am here for people who have asked these questions, meaning that they actually want the answers. And none of us need your negativity. No one needs your judgment. And we ain't gonna have that here. I'll delete your comment if you say anything negative. How about that? All right, now that we got that covered, let's go into the information. I got a little note here just so I didn't forget anything. The first thing I want to discuss is like vaccines. Is my child vaccinated? No, she is not vaccinated. She only has one vaccine, has only gotten one vaccine, which is the one that includes polio. And even now, honestly, if I could go back and change it, she would have never gotten that one. Why is my child not vaccinated? Personally, I am a very, very big person on history. With that being said, people who have been watching my videos, you already know the distrust that I have in this government, the distrust that I've had in the American healthcare system, because it's proven over and over again that they are not trustworthy. They have used our people for experiments. They haven't notified us or had even our consent when it came to these experiments that they use us for. I don't know if what you say you're injecting my child with, you actually are injecting them with. I don't know if this really isn't going to do anything harmful to my child. And I can't trust your words because that's all they are. I can't trust the internet because that's all it is. You know, the government even controls that. So with that being said, given what you've done to me and my people in the past, injecting us with things that we shouldn't have been injected with, taking away ovaries from women who didn't deserve that, you know, these different things is why a lot of us are starting not to trust you. When we get hold to that information, we are starting to change how we want to parent and how we want to interact with the rest of the system. With that being said, they will at the doctor try to make you feel bad and try to even make you feel judged as a parent when you choose not to vaccinate your child, like me, you know, and they will do over and over again to try to convince you that everything is okay now. Oh, no, it doesn't cause autism anymore. You know, no, we aren't doing it anymore, and blah, 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 and all of this stupid stuff that they say or that they try to say to convince you to go ahead and vaccinate your child. And for me, if you've done it before, who's to say you won't do it again and that you're not doing it now? I would not allow my child to be an experiment and 30 years from now, we find out X, Y, and Z, you did. And I, as her mother, who was supposed to be her protector, her guider, allowed you to do it when she was an innocent being. With that being said, I'll go ahead and take my chances on this breast milk. With that being said, as far as why she even got in the polio vaccine in the first place, that was a decision that I made in the beginning of my journey as a parent. I already was very hesitant about vaccines even before having her. I had many discussions with my midwife and my doulas about vaccines, and they completely understood my reservations, and they were like, okay, if you feel that way, you know, but then you also don't know, maybe you get the ones that are most recommended, as far as the polio being the one that they said that they could see me getting. You know, with that being said, as a new mom needing help or wanting help or assistance or guidance or consultation with other women, I went ahead and I got her that one, but I didn't get her any of the other ones. In her 9 months, she has not had any other vaccines whatsoever. And like I said, even that one, if I could take it back, she wouldn't have gotten that one. Why? Because this last dosage that she had, she was completely not herself at all for a whole like 2 weeks. She had a fever. Her eyes were really teary and cloudy. She was real lethargic. She was not happy. She wasn't smiling. There was literally, I didn't even know who my baby was anymore. And it really, really scared me. And I felt like as a parent, I had failed. And that's not to say that, because for me, I understand why parents vaccinate, but I also understand why parents don't. You know, so if you choose to vaccinate your child, that's great. I'm not judging you for that. And I'm just letting you know that in my experience, this is what felt right to my spirit, not to vaccinate her. And then that one time that I decided to, the one vaccine that I did give her, it made me feel bad as a parent, and as if I failed when I actually felt like I inflicted harm on her that she didn't even deserve in the first place. So, vaccines, no. Another question we get is, how long do I plan on breastfeeding? For me, I'm surely gonna go at least a year. I used to say that I would go as long as she wanted to, which honestly, I would want it to be that way. I would love for it to be that way. But honestly, because of mistakes or things that I didn't know in the beginning of my breastfeeding journey, given that I am the first one in my family to really breastfeed long term like this, I messed up when it came to my milk supply. So now I have to pump all day in order to make her milk for the next day, which is a full-time job within itself, on top of me being a full-time student, on top of everything else that I got going on in life. I don't really want, it's very stressful to have to think, oh my gosh, I have to make these 16 ounces of milk before tomorrow, and meaning that I can't be out doing this, I can't be out doing that. I have to make sure that I'm somewhere that I can pump every 3 to 4 hours, and then I'm pumping in the middle of the night just so that I can make the milk for tomorrow. It's become a very, very stressful thing. If it wasn't for that, I would go even longer than a year. I wouldn't really mind continuing to do it. But at this point, I know that I'm not going to wean her forcefully at a year. But I know that for me, I'm not going to stop at all before a year. That's never going to happen. And then after that, I do want her to kind of lead me. But also, I want us to work together to see what works when that relationship, the breastfeeding relationship, ends. I want her to be included in that process. I do not want to just take it away and just say no more. You know, that's just my personal thing. Another thing people ask about is co-sleeping. Do I co-sleep? Is my baby sleep trained? That type of thing. In the first about 4 months of her life, we co-slept 24/7. I know some people don't feel comfortable with it because of SIDS and different things like that. For me, I know a baby who passed from SIDS, so I'm not saying at all that that doesn't happen, because I know for a fact that it really, really does. And in my experience, as a breastfeeding mom who is like super in tune with her body and her child's body and senses her child in many different ways, I felt it was impossible. Even now, it's like impossible for me to like roll over on her, because I can hear the slightest sound that she makes and I'm not even in the same room as her. I just know, I feel her that much. You know, we're that connected in our energies. And that's not to say that these moms who have had children who had SIDS didn't feel connected to their babies as well. So I don't want people to take it as that. But for me, we co-slept. That's what worked for me. That was the way that I got the most sleep. At that time, that was the way that I got the most sleep, because she was continuously on the boob. My baby loves the boob. She is not on a 3 to 4 hour schedule. She never has been. With that, she gets the boob on demand, and I used to have to nurse her throughout the night, you know, and especially in her newborn stage. So with that, it just made it easier for me to just be able to sideline her to get the boob and me to be asleep at the same time, you know. So I did co-sleep, and then I don't co-sleep anymore. My baby is sleep trained now. I know some people got reservations about sleep training, and I once did too, until I stopped getting sleep, and I really, really needed it. And as a single mom, it's really important. And like I say, I'm in school, so it's important if I gotta go to class at 9 o'clock that I feel well rested, you know. And I wasn't feeling well rested because I was constantly having to get up with her in the middle of the night to keep nursing and nursing and nursing. And it wasn't necessarily because she was hungry as much as she liked the comfort of being on the boob, and that was the way that she would put herself back to sleep. And with us laying next to each other, the way my baby is even now, is that her smelling me, she automatically wants to feed. You know, it's just That's what she wants to do. So with that, it just made it easier for us to separate as far as our sleeping environments, so that she can get as much sleep as she could possibly have, and I could too. That's where we're at now. Yes, like I said, she is sleep trained. If people have any questions about that, let me know. But I'll just say this: sleep training, oh my gosh, it changed my freaking life. That's the reason that I can sleep, and the reason that she is sleeping at least 9 hours before she wakes up once to eat, because I am still feeding her about once or twice a night. But she can go 8 to 11 hour stretch without eating, depending on the day, depending on the night, whenever she feel like it. But at the end of the day, it wouldn't, I know for a fact, if we were still co-sleeping, if I was still just comfort feeding throughout the night, it wouldn't be that way. And I would be 9 months into parenthood feeling real desperate. You know, and I'm just glad I don't feel that way. That's that. Another question people have is about veganism. Are me and my baby still, are we vegan? What are we doing? Blah, 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 all that good stuff. Kamaria is vegan. You know, I have not, no purees is made with meat. She does not have any dairy products whatsoever. I do give her yogurt, but yogurt that I give her is coconut milk based yogurt, not dairy based yogurt. So yeah, she's vegan. Are we vegan? Are we going to continue? Like, is that a thing? For me, honestly, at this point in my journey, I would say that I'm plant-based more than even vegan. You know, because I felt like I used to be vegan before pregnancy. Most people know that pregnancy, I wasn't vegan at about 11 weeks into my pregnancy or something like that. Then after that, I went back to being vegan. And now I would say that I'm more plant-based than vegan, because I don't have that strictness on my diet in the way that I did the first time around. You know, now I'm at that place where I'm a little bit more flexible. You know, like I just recently, me and her both recently went to Puerto Rico for a vacation. When I'm somewhere and I feel like I want to connect with the culture, or I want to connect with the people, or if I want to try something new, I don't limit that. I don't limit my diet or whatever the case may be, depending on the circumstances. But I am very, very selective of when I choose to intake meat or dairy products. It's not every day whatsoever. It's not even every week. But if it is a special occasion, or I am a special place, I don't want to feel like I can't eat, or like I can't do this, or I have to hold myself back or limit myself because of the fact that I have this label of being vegan. I'm plant-based. With that being said, as Kamaria gets older as well, she can make her decisions on her own. I don't want to force anything down her throat. All I can really do is encourage the lifestyle that I feel like she should live. With that being said, I'm already doing that. She has not getting any meat. She has not getting any dairy. And I will continue to raise her up in that way. But I also know how important it is to kids, especially, to feel involved in eating. Like, say, if they're at lunch with their friends, or if they go out to eat with their friends, or whatever the case may be. I don't want her to feel like her childhood or just being a kid has been taken away from her, because I have restricted her in some type of way, especially in ways that I wasn't restricted. I was allowed to, you know, experience those things, and yet I still came to being vegan on my own. That was a decision that I made on my own, which is why I was so heavily embedded in that decision. But I feel like forcing her into this lifestyle that she didn't choose for herself, that will only make her more resistant later on in life. Like I said, my job is only to encourage, you know, healthy choices, positive outcomes, and at the end of the day, she can only make her own decisions. That's not my job. That's how I feel about that. The last thing I wanted to talk about, which I feel like a lot of y'all are probably here for, because so many people ask me about it, is marijuana. Did I smoke throughout my pregnancy? That's one of the main questions. Yes, I did. Do I smoke now breastfeeding? Hell yeah, I do. What did that look like for me in a hospital setting? One, I made sure that I was at a hospital. Like, I knew that the hospital that I went to and I gave birth at, I had talked to other mothers who I knew were not drug tested, for one. There was a hospital that I had experienced one time prior, and I'm only telling y'all this because this could possibly come up in y'all experience. Some of you are pregnant and y'all are wondering about this. I'd experienced one hospital who took a drug test on me without my knowledge, without my consent, and they did come to me and say, hey, yeah, we found weed in your system. If you don't drop twice before giving birth clean, then CPS is gonna have to get involved. That actually did happen to me while I was pregnant. What did I do about it? I stopped going to them immediately. At that point, our relationship was over. I found a new healthcare provider. And the thing about that is when you find a new healthcare provider, if this ever happens to you or whatever, finding a new healthcare provider, the previous hospital had that in their records, but this new healthcare system that I was in did not have that in their records. They have to actually get my signature in order to have my records released from the last hospital to this hospital. So when I got to that new hospital, I never told them that I had ever been to that other hospital. They had no knowledge of the information. They had no knowledge of that record because I didn't give them that information. The main thing, as far as, because now I'm in a social work program and I am amongst people who have been CPS workers, they've told me that the main thing about CPS getting involved when it comes to weed and stuff like that, they only become involved when they have suspicion, at least in hospitals that do not regularly drug test all of their pregnant patients. They only get involved, CPS only gets involved when there's actually reason to. So don't go into the hospital smelling like weed. Don't ever bring up weed. Personally, I did not talk to my doctor. My midwife, as much as I love her and I trusted her, I never told her about the weed because at the end of the day, I just did not want to, I didn't want to risk all of that. But I knew that they didn't drug test already. And another thing that I did, because I just wanted to let y'all know as far as when you have your baby, right? So another way that you can kind of get around making sure that they're not testing your babies for drugs is come up with a birth plan, and have this, talk to your healthcare provider, whoever that may be, before you even get to the hospital for labor. Come up with a health plan or a birth plan, and in the birth plans specifically say, I want my child right away, like after my baby is born, give my child directly to me. I don't want my child to be taken away for any testing without my consent and my knowledge. That's the main thing. I said, I literally reiterated points. Don't give my baby any tests without me first knowing what the test is and agreeing to it. These things they have to follow. As a mother, as a patient, as just literally like their ethical principles, they have to follow what you're saying. So if they did want a drug test, they would have to come and say, hey, we want to test her for drugs, or we want to test your baby for drugs. And that's up for you to consent. The main thing is that what happens is that we don't take control of our own experience in motherhood and childbirth, so they just do what they want to do. But if you put it in writing that what you want is to have your baby right away, for them not to have your baby do any unnecessary testing, and if there are tests that they must take, let you know what tests those are first and get your consent. That's what they must do. That's really all. I had literally no problems whatsoever at my hospital. But also, literally, just check it out. Because I don't know about every place. This is only my experience, and I'm not here trying to get you in trouble. People have asked me the question, so I'm giving you the answer from my experience. I don't want to have no comments like, yeah, I did what you said, and then this happened anyway, blah, blah. Look, this was my experience. I told you what I did in order to get around it, at least in order to assure that me and my baby would be safe from the circumstances of all of that. But at the end of the day, that was my experience. And I can't say because I don't know the culture of every space. I don't live in Texas. I don't live anywhere real conservative. The information might look real different when it comes to places like that. Maybe you won't have that freedom. I don't really know. But I'm somewhere where I was able to have that freedom. And if you feel like at your specific hospital or where you are going, you don't have freedoms like that, maybe you will want to change your healthcare provider. Don't feel like you have to go to the doctor that's right there next door or whatever the case may be. Like, literally, usually when labor starts or pre-labor starts, you have enough time to get to point X. And like, for me, I was laboring all day before I even went to the hospital. With that said, you have enough time. Don't think that you need to have a hospital that's just right there next to you. You know, if you don't feel connected to them, find somebody you feel connected to. Find somebody who you really trust. Find someone who you feel like actually supports your ideals and wouldn't even want to put you in harm's way or want to get you in trouble. Find somewhere like that. You know, birthing centers to me is the best way to go. Home birth to me is the best way to go. Midwives to me is the best way to go. Doulas are surely the best way to go. But at the end of the day, if all of that is inaccessible to you, at least know that the space that you're in, you actually trust. The first hospital that did drug test me, I was at a Catholic Christian hospital, Saint something. With that being said, don't go to none of them because they will drug test you most likely because they have this, you know, faith-based thing. But outside of that, yeah, like I said, I didn't have any problems. They never took my baby outside of the room. She was with me the entire time. So that was really that. They would have only drug tested her if they felt like they had a reason. Like if I were to smell like weed or somebody around me would smell like weed. So if your partner, if they smoke weed, let them know they got to air that shit all the way out or don't smoke before y'all go. Because if they smell it at all, then yes, that gives them reason. So yes, protect yourself in those ways. This was a longer video because that was like 5 questions that I answered. If any of y'all have any more questions or want me to talk about something else specifically related to motherhood, related to spirituality, related to whatever, just let me know. I'm here. Y'all know I'm open. Like I said, don't want your negativity. Keep it to your damn self. All right? Thank you. Peace, love, Black power all day, every day. Ain't no other way. Okay? Love you.